Your friend me Veronica. I'm here at Nazik Medical Center. Actually, my friend, my sister is on there. On me because after the health talk, no, the person me check BP ni your sugar. Say me unko mean to me nye. Ono so your nurse ni. Say me obobo dia.
But your friend me Jennifer Buedi. But your friend me Jennifer Buedi. But your Mrs. Safo.
Okay, say I can say regular health checkup okra. Any day. Regular checkup any say. Obeko hospital. Now I'm our doctor. I check you. Now I'm who will health status. Ebini say ebia o BP, ebe hu say eye normal and I say enye normal. O sugar say eye normal and I say enye normal. O cholesterol say eye normal and I say enye normal. O weight, o BMI say eye normal and I say enye normal. If some of the terms ni be on ma can say won ti asia. Obetimi ebisa me na my dey. My trim. Regular checkups important. Edi na regular checkups dey ehun here. Eboa ma detect diseases very early at the early stage. Yemu bi wa hono ma na me say yen ko regular checkup ntino. Say ya rekra na yenye de yenim. Nti yare ni timi hye ye ho saa. Ye twen ma yare ne dey reach the end stage ansa na ya dey. Ya kwa checkup no. Eba sa na ma treatment ni a very long treatment amount. But uyo bi a wota akwa ma treatment ni ye dey. A very short treatment amount. That is one of the importance of regular checkup. Mpacho mi maybe some questions. Into no importance no ba kono no. Mpese mi wie na mi bisa question mpese mi hu say ansem na me kan no. Mutia na ansem anyi dey mo anti. And the second one nso ne say a preventive complications. Hey, my voice no so no. Me muya me yenti no me voice no asa aye yi kakra. And the second point ne say a preventive complications. The second point for regular checkups ne say a preventive complications. So okwa hospital na you detecting in tema. Ehun yare ne hu sunsanso na ye dey prevent it. Ebi wo hono ma yemfa ne sese bi BP wo bi so enam se onko regular checkup nti otimi sori anopa se wo kwa adwuma o ya adwuma no otu ahwe enam se onko checkup nti no complications we na doctor betimi a prevent enso se nam se onya checkup nti no prevention na anye dey ama enura wa se de man prevent no wan ko checkup ama ya mfa se enuro na ama no nti e dey ya na complications no ebeba. Into the second point, you say a preventive complications. And the third one, say a monitor existing conditions. Like say be a mechanic, no be on ma a situation area one so. So ota hospital and I see a check here. A member doctor na monitor. Sugar level, no say air costro, say air bafom, say how it send you city a diania was say woody. Ebema sugar na yese niema e wose we ya ebema sugar na yede enkosro. That is the third point. Into the third point ni say a monitor what existing condition. E boa ma wan kasa wo mu no ye follow up. E ma doctor ni so ye dey. E ye follow up e wa we yare ne ho. And the last point for a regular checkup ni say a receive preventive care. Receiving preventive care. Regular checkups, like let me use let me say hepatitis B. Also once in a while I told that you come to me say young hepatitis B tests. Just to check the level of what your hepatitis B. Sometimes it say check na say below 10. Yetimi e catch you say kone kwa the hepatitis B vaccine no. So check na say above 10 na. Or more eka said a normal into some kind of so yeah, that is why I companies be on my juma every 6 months biano the ma require hepatitis B test just to know the level of the hepatitis B, you know. Say below 10, more advice will say go for the vaccine. Say above, no more advice will say take a vaccine, no, because it's normal. Ipacho ya kasa afa regular checkups on the importance. So now I am coming to talk about the health habits that support good health. The health habits are supporting good health. One is to eat a healthy, balanced diet, like diets rich in fruits and vegetables. Eboa. And the second is to exercise at least 30 minutes on most days. Some of us, minim say you exercise a lot. You kwa adwuma ye fra adwuma ba ye bedidi ya straight to bed ni ada. Ye didi we ya ni ada. Let me say 90% of us ye regular exercise. At least a day, maybe 30 minutes walk could be, and say 20 minutes walk could be after work, and after dinner cry before you go to bed. Okay. And the third one is we have to drink enough water. Drinking enough water and also a very good my health. And then next is we have to get adequate sleep. I was say that as an adult, at least 8 hours a day. Most of us, we don't get that 8 hours a day sleep. We spend about 5 hours on our phones. You spend about 5 hours on your phones, so then you better 3 hours, 4 hours. Now you sorry akwa adwuma. Ni nyina editoriate your health no. And the last one is that we have to try to avoid smoking, and then you limit alcohol intake.
I hope you.
The last one, a health habit that support good health. The last point is to avoid smoking. Now you limit alcohol consumption. Okay, makasa fa BP ho, makasa fa sugar ho, makasa fa cholesterol ho. Enti no, me pese yehu. Me pacho pese me hu why na normal BP. Like the normal BP. As a human being with normal blood pressure, and I was say like you name value no, why name value no wa. 98. We consider that as normal, but not the normal level.
120.
Yeah.
Because recording
Yes, 120/80 is correct. It's 120. So I will check your blood pressure no. Not say 120/80. That is the normal value, but say 90/80, 180, we consider that as normal too. But if it's below, that is the 80, 60, say below that, that is not normal. And in a day, who say your blood pressure and your normal. To go for a regular checkup, but ye mu bi wa hono ma yes wakoda ye wan sore ni BP onim ni normal BP kra onim ni blood pressure onim ni sugar say ni sugar na level no ye de sen say yes no an say ye koba sa da kro ye say esichire ye say watwa ahye nipa na koda wan sore. We are doing a very hard work here. Meaning say na ya wa ha nyina na ye very hard work, but regular checkups in so hu ehia. Ema ye nipadua ya nkasa ye mu na hu hia maye. And I know say most of us na ye wa insurance 6 months to go for a regular checkup no. Your insurance ebe ye dey. Ebe cover. So okay, so right now, no, I want to talk about the normal sugar. Sugar, you're afraid to be random, you're afraid to be fasting. My situation, The normal sugar no range from 70 to 90. 70 to 90. So we check na 100 to 125. We consider it as pre-diabetes. And then I say check up on time ni pre-diabetes. Not just say I feel na oya day. I don't know when, but it's not at the early stage. And I say 126 above, and you can say oh yeah there or diabetes na ankasa no. And to prevent that, you know, you na say you check your sugar. Ebema ye hu your health status. Okay. So fasting blood sugar no, I think say the blood sugar monitor no nebuwa ne price na share da enye den. Ana BP apparatus no kra no nebuwa nso share da enye den. Enye den. If we have such such apparatus in our homes yan kasa kra ye betimi aye den. A check e wo fie. Nti wo check na say wo hu say e was stra. Then you visit. Then you go to a physician for the physician to review, to check you again, to know the next step. Sorry, I don't want to describe. There is a colleague I know at work, or a guy named Penasempa. That was on Thursday. Yeah, me first send it on your checkup, and you're checking the BP. That was 170 plus, and I was like, on the number normal. So I was like, BP area was one. Was ya na me checking in kakranka. Come say 170. Baby and kebeje what to hono mama ya make sure say e best so better kran san wa kofi. O nam kwas na akotu hwe sesie ya. Obeka say sabi can say we fear ben for na yon so na nya wo ma. You are the one not taking care of yourself. You are the one not taking care of yourself. So for the doctor to review her no, they say yamano BP tablets for 30 days, and after 30 days, I also sound so back and check it. And monitor and so come sound so many beyond one casa air check up fee. And the next thing is your weight. Yeah, like you wait to correct if you say, yeah, mood your mood. Your mood. Yeah, I'll say I call hospital. Normally, I know much check your height and your weight. Now you determine your baby BMI. And then the who say, we you overweight, we you underweight, and I say we you obese. Into your car, Nina, I bet check it. So we are underweight. And only say, whoa, as your height and you weight, you know, you check here. And with your age in your check here, like, weight now was so win extra. And then I be near the what to aduani be so did the aduani say ye say be ma weight na day increase it say a normal so on better how bit be maintain your normal weight no ye obi wa hon ma who say like she is too masculine but okojina weight scale ni so ne checking the BMI na normal obi wa hon so or yes or a little bit slim, not too slim, or checking the BMI, the height, and any weight, yes, or you're overweight. Thank you. And you mean, person make us such a be because Yanka Salama mantem, and I had time in so a day. It's shot. Until right now, no, per Muhu said the importance of regular checkups in my bobo to be brave. No, it's time for me to ask questions and I will be bika.
Pacho made the Kakrabe coming sister there. He said, your baby screening into BP no any sugar level never checking. And you say be in day I check you number or results will be no and they determine say we are diabetic. And I say hypertensive. I was say, oh my, who be me fan say be a 5 days. 5 days, you know. I was someone check it like me name so we call hospital. I ben and a clinic a ben 5 days, you know. When your regular checkup. Now who say figure na. Now who say figure now when you were hano cost and I back from because sometimes who say you move be a free juma ne abaha nti no sa no ye check you BP na e betimi affect figure na e binya obi ho a onante ya wabre nti wo ba sa no ne ye check ya it could be say because meanwhile that's not your normal BP nti mpacho figure bia e binya ma no it doesn't mean say we hypertensive and I say bia we diabetic I was say on to us it's either for 5 days and 1 week what the man was say oh this week there was say me call for regular checkup on my BP and I say me sugar level no and no be tell me say oh okay nti na ebia me didi ebia ndem me koda no me didi wi ana me die nti no me ba ye na me be check no ama sugar level no akosoro and I say me dream me kana na my so exhausted from work nti me ba be check na akosoro nti mpa check a enya yim hihye ti say bia wo BP ashutu akọ up dodo nti me na mo nya me BP na nti sa it could be say one to say na make no unante a wo ba ye na ende adwuma wa ye no abre ene na affect figure na ye nya ye no nti mpa no na me pese me fanka ho nti emma ye ye me hihye yen ina e to down so a ye be check a me wa anti immediately a wo yi wo BP apparatus na no wa hyase na koma abo osu like osu and also betting affect figure na ye binya no nti mpacho obi and relax like kan wakoma to yim say na be ya e betimi nya wo I mean figure obehu say oh okay we na eye me number like me number na me figure nkasa me check it and that's what I got na yehu obi baby a wo china nti mpacho obi relax enye hu bia mon kama koma to yim na after the screening yehu baby a obi ejina ndamas
Let me think me baby sa questions. Baby sa say baby say more questions. Okay. My president. Okay, president. I think so. And okay, the befra. Now I am mix.
My question. I have two questions.
Okay.
One, what are the symptoms of blood pressure and diabetes?
Very good.
Two, say your blood pressure. Me sorry call pharmacy say me top blood pressure. And I say I will send me the prescription. And I say I will send me physician.
Okay. O question no. The attorney say blood pressure, any symptoms. That is it, blood pressure, any symptoms. I think that some of you are confused. More of phone, one can somebody to me a day. I go check it. Say blood pressure was symptoms. Obi to me what blood pressure as no nam or yet the baby blood pressure any symptoms. Blood pressure anti say sugar yare are a symptoms. Blood pressure na anti say yemfa say yes obi wo hypertension blood pressure say no hypertension obi wo hepatitis ema symptoms no. Blood pressure they call it it's a very silent illness bia say wunya any symptoms and until na very important for you to go for the checkup no. But diabetes need sugar need our symptoms.
The next question or say you bet me at hospital. Pharmacy.
Good. One me question na me dey man say unim say oh sugar yare no. So when you sugar yare and also when you BP yare na you cannot just go to the pharmacy to get the medicine. Now, and for me, the minimum say no. It's not allowed for any pharmacist to give you a BP and I say sugar a draw without prescription from a doctor. I had to say, can say Ghana, you can just go and say that, mommy BP a draw, mommy sugar a draw, mommy this. They are very strict. I don't know from other pharmacy, but baby, I mean, when a pharmacy there, you cannot come there and say this. They will not give you. I'm on pharma unless you have a doctor's prescription. Prescription no crown with a doctor's stamp with signature. Without it, no more pharma.
Before hypertensive no. Obeko hospital send na America no. Send America no. Unse and they are checking what there was wrong. Nti no obeko so a check maybe within 1 week now check here no. Doctor I'm one who say oh ebia we are hypertensive and I say wenya like after the 1 week you know. I was ra nti e ho no odo betu eduro so. Mostly eduro no ye betimi ama 1 month and now 2 months eduro. You bet sure will send our fan every day, like daily. Either daily and I said twice a day. Into a drone so before a besano, Yama 2 months a drew. Into a besano, Yabeka show say bra. Into the doctor already no show no more druno. Or bedi come why I wear say bra for review. Ebia in 2 months. I just say bia when ya like problem be answer na obet me about within before the 2 months. By a drone or person on say offer. Na wo fa na nsunsun so be na ma until 2 months na the amount esan and what's a drugstore because sometimes you ndro no edura ye de mem obi a company bia ne neduro ene se na anu edensi fa enti no doctor ne de ode ma no ono no wa ye wo labs we hu se ebia te se labs na ya ye ono eduro we ya me ma ono eno na ebeje wo do obenya the same drug no wo hospital like pharmacy outside the hospital. But ebia not say drono ne we no e was so ne anu ede ne was so than the doctor ne the amount ntimi pa ocho onfa wo pe because me ye wo me wo emergency ward before me ba no obi wo hono ma obeba no o say doctor me eduro ne sign makoto bi wo like outside the hospital miti asa me fe eduro na miti ya me ya the same drug though, but companies no so be the same drug and at all. And sometimes dosage no different. E be one ma e be an pen 20 milligram na mama but over got on pen no outside no. Na 30 milligram. How will you know? A doctor and as a nurse in our show no bet me actually. And say you're so wrong. So one gasa over found who say medrasa and now pominde drew so. One day be and now my check me BP wahanomo. Yes, I was running to Manco Hospital. May call na pacho a very wrong tea. President pacho a very wrong say. One cassa over found now prescription it be a draw one no massa. Now they are called outside the hospital say, oh quaco to be pacho a wrong no.
Okay, mean chana no answer me casana make I say lady be where you men BP need this. Nobody can call NMC ama NMC hospital man BP adra no offer. Wa fakra wi but still doctor ne check here na ayede. E was through. So the doctor realized say a drone na offer na nyede emwa no. Inti e was say a drone man e de edro foforo. Inti no say okọ na wan kasa wa ma a pharmacy a prescribe a drama no. Enene de emwa. So it's better to see a physician for the physician to review to check if some medicine a drone or the amount a year juma na say enye juma.
Okay. Another
President Pacho oh yeah okay.
Oh, yeah, okay. Another question.
Me come.
So, Pacho, maybe one.
And there was some cracks.
Nancy for what you at the end of this lady in Abba.
So what the question to me say man no baby said then ya really ba e dey na bibi
I don't say lady in Abba.
Partial to add to his no broken heart into to me my high. When you're broken heart, I will drink. Maybe someone himself broken heart now with different levels. Maybe why invest it why invest into the relationship? Na nipa ne jaw impromptu. Adwendwen ni wetumi ma wo BP kɔ high na we. Pacho, my
Yes.
ase why?
Broken heart betumi ama o BP akosoro. And the broken heart, is not broken heart, is not only in the form of ebia or buy jam and I will be to me losing investment or be to me losing like a family member. Na shene pa. All of a sudden, no one send the BP, ne like palpitation. Na asha see a bo. Intend there, it's me at the back. It's me at the hypertension. And I no so no mon sama ne bruise be so a it's and I said normal and sanum de also bit me no mon sana bro so a bro so and what did you say?
Mpacho say ya cancer no ma edu baby a my sister ka say te say ata o ka say ono ma ne proso say e bansa no ma obi o hono ma te say ya diagnosis of a condition e different from obi a ye be fa ne say ono no ye onyare wo yare na this person no me fa ne say sorry say wo yare obi ni yare a umfa ho nto ne say mimi ni yare nti ensa no me no ne kese nti how much more wa ya diagnosis of a condition that means one no dwane because there was some testing yeah wa on ni show the number of alcohol percentage of alcohol e wo wu ni pedwem a wan hwa wo ginewu but now wu ni nti misramo obi ho a wo condition e bia ende nyame adom ye yegu he nyina nyame adom ye nyare nti no sorry to say ye mema no na mutimi bibini a ene boy ya ye hweko bi bedum sansa na ode ahwe enti no
Obi to me jubilate ya na kana koma no atu ahwe
obedidi kakra obeka say me ko twa bi misra so wo any condition a e was say stay away from alcohol at least for some time na hwe say na wo health no ebeko no ba e bia obi ni condition bia na fine and no your lifestyle means me say jai because e bia enye easy say obi jai just like that and no misra no we hu say na obi alcohol intake no ebeko no it's mpacho alcohol ne de very important say you be check your alcohol intake no in our condition na misra what try say at least we best stay away from alcohol.
Okay, mpacho send me
because you have a condition
me see maybe some questions.
You have a condition it's no me who say who at risk of say who be coup person and now obi buy so because if you have a condition and once you joke with certain things but obi only any condition no mesra will say like don't compare yourself to this person ye pie or no monsa now we watch check say oh me because of ebia me condition into no ebia me no monsa what mpacho what I say ebia make akwa wo dey do so wo hu enti ebia alcohol enye ma wo with medications na wo fa no enti mpacho no what try say you stay away from alcohol for at least a while no who send our condition be
Veronica so bisa.
As a question wa ha yan ko ha no ko bisa. Mpacho nya abotre.
Kasa. Me question here say, yeah, we are kataba we need to have any bobo no. E beti mama we na kostrana. E beti mama ye beef na kostrana.
Footballers no.
We.
Football.
Say footballers so mu gina wi aso bobo no eno so etimi peja.
Oh, this heat. Mobile boy, heat.
Yeah, just as 4:30.
yeah
Now
heat where
I don't think say advisable to stand in that heat. Heat na no thing too. Yeah. Yes. Because we are raining. Bro. Sorry. You don't good microphone.
Oh, now they me kasa kura kwa chiri sino we yo. Okay, be about cholesterol, but na me ne ya.
na also makoma ye nti no me question is say e den ye ne ayefun say be yefun e ba because the person reduce because
cholesterol.
my mimi say me question paper chow then ye be as a nurse am my advice then ye be ya e betumi because ye trading all do but we still need your advice e bia o mundi we to help our body.
Okay, it's a very good question, and I'm glad say we are training. Yeah. Yes, I think say although we are training all right, but if you can reduce your fat food in like don't eat fatty food like very reduce it shouldn't be more food that containing a lot of fat like on say some kind of oil be crying out you have to check if it is cholesterol free. Oko supermarket oils be how no ma ya tregu who say free cholesterol. You can buy such oils no use it. But the normal oils now you're using they contain high cholesterol.
Okay, we will allow for only 2
And
questions.
in young some questions they need to be sapelika home.
Mpacho unse mpacho me de kakra beka me sister penny de no.
Young some
About
questions.
cholesterol level now o kana. Na me sister account about ye didie. Unse no o ka say how to prevent we like there was a point and now or try say yen
A
eating
regular health
balanced
check.
diet.
Yeah.
Unse ye didie no. Metimi aka say yen Ghana for ye wa ha no. Me ba ha no me hu say half no. Omunuane no leaves like ukwa outside koto sa biryani ni kwa mama some leaves vegetables and then but when it comes to
And
your
crime
side
can all.
yeah na ayedi no anye banku ni ade na ayi unya sa leaves ni wom nti no ukwa ejuma wa bre do wo be didi anajo wa bre na wa be efie you have to eat because we are very hungry me pa cho fa wo be nkusi nche mia weni nya fruits bi egu fridge nti no nka ne yie ma nka no like anopa enye early in the morning no wakọ edwuma no ebia break time we didi heavy but what be efie no to say ebia kwamo de wo hwa ho ntimi nda because aha me hu say asem very late obi wo ba be do 11 pm udidi we ya ehọ na wa hwe ya onho ne so beda nti me pa cho wonya wo banana wonya wo apples bi ni ade hye fridge ma ubetimi ayede edibi umia wen because fasting Emma will lose some fat cholesterol will be when you fast you lose some fats into pacho ubetimi edi some fruits na what the other into fruit and so be on say sugar at least send na my sister can we do fruits na we kra no ubetimi ama ho 20 minutes bi we be abonte ho one anti from end to end na fe wa ba bedware no wada pacho no ebeboa pa ama cholesterol level no akofom nti ya brese den yemia ni say yembedi banku yemba mbedi fufuo na ye da hye fridge ni no anajo no mesremo enye easy
1
I
a.m.
know
no be ka konkonte.
I know because sad no one support yeah sorry sad the ema ye fu ye kase especially young ladies no ye pe flat tummy but when say flat tummy no enye easy say obenya sa na jo no wa brain na accommodate the more na accommodate no me pa cho mutie ye bu aje kum france obeka cho say brain no ebe mo we hu say
Say it was 10 minutes spent.
mpacho enti me sraw mecha so se na me kan na mpacho fruit bi a veggies bi a no we mi wane no we di na wo de aye den wo de ada anopa wo so we wia break time no obetimi edidi heavy na wetin unwu nyame se no unwu da why
And opese who cholesterol hello bra. Opese who cholesterol level na. Ko hospital near check you. It's very affordable. Say if your insurance in cover crana very affordable. Why?
Okay.
Brame ho you better check your no.
Yeah.
Yeah, my questions in the meant me be so.
Because let you know, third time question.
My question is until less mpacho ban your 5 6 no ho a say be ma bi obaka say me kwa 1 2 3 4
Ọbẹ kosa, mo wani say team. Na wewu. Yeah, esi.
It's true.
Enti no, eno no e the pressure na man e basa na say.
That palpitation. The basana. Oh, home no.
Aha.
Yeah. Also, Mpacho, me worry into no mean to me sister be answer question. That question na mama.
No, Ubisa say prolonged sex na che. I said be messy so 2 hours, 3 hours, sana woka. Obewu because mu sorry say me can we. Un say see me na every be ma ho ba no. Yes, muja.
That sex itself, is like an exercise.
Sex
Like
itself no something good.
Like an exercise, but into continue
Oh yes.
for
Nah,
but continue for 3 hours.
the person me say sex itself no pa ema ye mba ma mo man so ma ye nyina but e was say wonji wa ho be ma lucy semen bia na wa hwere bibi ntu be hu so ma bre pa obi ho anoma akọ 1 round na obi hu so person onji na ho me na on regaining some strength enti no see oba ne so obetimi ewu because like beba you are not stopping wo hwere moja ubetimi ewu what I say enti no be rest we did like you have to strengthen our loose no I was saying on replace na what was ubetimi ato asa na what was but say ubesi ne so a pa cho wan sha en na o kan o BP betimi make a cry be cry na o BP ne da what I say the more na heart no like
regular
palpitations
heartbeat,
one shot ubetimi
Then
ahwere
say
ho
through 180. After a table from crying timber.
200 na ubetimi
But me met me beside the
Yeah,
question.
sir. You better shut up. Na ya baba discuss about sex in the because
Sex education. Me say, how many do
last question.
Abusuafo,
me questions in the
Mesramu, Midiani, your boy, Jacob Francis. Mese mi huru say enti wo ka sex as mese mu say within a week no do send pan and can say as a bema yeah within a week do send that be wa boss to answer
Yes. Okay. I'll see.
More way no about the stomach and this thing. Ejuma na ya wahano. Mean to me nka benku ni we nko. Sometimes maybe makwa ejuma from 7. My point to say 4. Mean to me area no yenim say was say ndidi heavy. But mean to me nka benku. Mean to me fa fufuo nko. Ba ma ba na ma bre no maybe ma ba no pese me nda kakra. Ansa na menyane na ansa na medidi. Ekwomo de me. Banana hina media meme. Watermelon hina media meme. Ekwomo de me yem. Enti I don't know what man then.
Okay,
Benku no hu nya me. I was saying energy. Ade be chi a meye we. Now sisifia no so me pe. Man then.
okay.
Advice ye.
Epacho, epese me hu the time or did that. Time me pacho mpese me hu time udi like or last aduane any time or did that. Then I will give you an answer to that question.
number time be na wo pon
Time ben na did that.
da be time wo pon ba na
Like
da be no
okay, say eating healthy, no. Okay, say we are not supposed to eat heavy food at midnight.
Depending on the time you sleep or the time. For instance, Yaba has
Mm-hmm.
video.
Oh, okay.
Watermelon
But still, and you're healthy to eat around like 12 a.m. Now we did banku, then direct koda, and you're healthy.
Me pacho
Still, it's not healthy.
Ade papa bia anya easy say be ba o. Ade papa bia o wiase bia no normally no. Enye easy. Why? Say beba. Enti mpacho mi a when unsa wo say wopon adwuma. Wo pesa wonda. Enti na mpesa mbisa time be na wo bepon because ebia wo bepon daytime. Sa daytime no wo betimi edi wo banku because enye anadwoye. What I say? Sa time ni di wo banku. Enti ebia sa 6 p.m. 7 p.m. 8 p.m. now wo feel say oh aduane na atwe me ho kakra na say me pese me ndi bibi no. Then you go in for your fruits. Dabi, eno de amboa o.
Say even crying so odidi at that time. Now owie now take
Now
a
na
little walk
ya.
okra na eye.
Aha.
Yes.
Sis, me pa cho. Me pa cho. Wo 8 no kra no fine.
Odidi
de
we
fa
now
say.
be na ntekra kakra 30 minutes walk
Se ne
okra na
kan no
eye.
ma ho be
It
30
helps
minutes.
digestion.
Na one na take kakra eno na be bua na digestion no
Why
take place na. Wait
exercise?
me akoda.
Okay, and according to the Moody Divya, I say, my home
Exercise kakra 30 minutes, 20 minutes.
Walk be up here bontan and
Ne
tina.
dwane tina digest.
Entina Quomu, yes, baby.
Epacho. Yes. Na kaya
Pacho.
time no so ko. Epacho. Me questions no. Me pese me hu say ensem na ye kan ye no ye tie na supem. Epacho me pese me hu say me sha say me ka regular checkup. Regular checkup no ene de. E de kra ni regular checkup. Obi betimi ayi ma no. Yes, so we are real, so we are real. Obeko no aye dey. Wako and I make an importance of regular checkups and also so be to me akeka bi akere me a.
My question is Madam Ness, when you know.
The question is led.
Yes, say you're quite nice in the past.
Oh, the cashier say it's advisable to stand in that like this degree, this heat to play football at that time and yet.
Yeah, of course, it's only say you exercise.
One question I will ask
Uh,
okay, according to UAE health and safety policy, this month in Pakistan is not allowed.
yeah,
So,
it's advisable.
Whether we know we also say oh bobo.
Bola.
What you say? So I think so this month from on the 15th onwards, no. Omuchi we also say oh bobo and I say even say we ejuma krana. Say who under company or company fine. And secondly, to add to that, so bobo at that time in this heat, you can make sure say there is water around you. Say obe numu you. Bobo boy be 15 minutes, 20 minutes, no. No work on you. And yes, I did you end up getting heat stroke. And I bet how. I what you say?
Okay, Ike, to add to that, but to add to what President said, even professional footballers, teams are more allaying now. Pre-season cap are more corner, other countries are a little bit cold, so that they can train very well and then come back to start their pre-season because of the weather. No, and I said they will train midnight, from 10 p.m. going, and on training. Thank you.
Importance of
Regular checkups, yeah.
it prevents further complications.
Okay, thank you. Mpacho wan subio. Yema for important. You can fall. Yes. Mpacho wan subio. Enipa mi onu pen etimidi tu o mutrim. Sex so dan ke di betu yetrim o. Okay. Mpacho ene ya be sha ase a check BP ni sugar no. Enye force, enye compulsory. Wa opese wo ye no. No wa ba ni a check am e free.
Do you need anything?
How it is when you accept?
Yeah, one sase man.
I mean, yes, yes.
But me and shy. Ebe me an kakra. Sorry. Say we no normal. Check them out. We normal. Ready, mommy. Ready for us. Sis. Anya kwa. By stole ni but you relax. This is how you know. It shouldn't be.
Just give it to
Mami fa moja ni.
I don't know.